I'm Maggie Throup'S, a Member of Parliament in the UK Government, and I served as a Health Minister from 2021 to 2022, specifically as Vaccines and Public Health Minister. So I've got a really big interest in seeing how vaccination programmes are organised and implemented in other countries, because we can all learn from each other. We're not perfect in the UK, and I've seen some things here in Kenya that are really interesting, and I'm sure we can do a lot more in the UK and more working together as well.
You mentioned you've seen some things in Kenya that were interesting. Can you maybe mention some of the your key observations you made during this visit?
I think it's really important that the children are captured very early on and vaccinated. And we do that in the UK, but I think it's the way you've been educating the mothers and families as a whole as to the importance of vaccines and immunisation, and how you've got the community leaders going out and the people who are trusting the community. And that's something that we learnt in the UK. There's quite a lot of fear sometimes, and also ignorance about the importance of vaccinations. And they don't want to hear that from a politician or even from a medic. They want to hear it from the people they trust. And you've already been doing that with your community health volunteers to actually let them talk to the families, the families that know them, and everybody trusts each other. So to me, that's one thing that we need to learn and do more in the UK. I think we take vaccinations for granted in the UK, and yet here it's so special, and because you see the impact if people aren't vaccinated, the communicable diseases, the infectious diseases are still quite prominent in many parts of the world, not just in Kenya, and it's the easiest way to help people to keep well. I say that after clean water, immunisation is the most impactful preventive measure that you can put in place. So the more people are vaccinated for any disease, the better.
Did COVID-19 play a role in the acceptance or reluctance of people to take vaccines?
I think it's a bit of both, and that's a really good question, because I think people were very, very keen to get their COVID vaccine because they could see it as a way to getting back to normal life. But at the same time, it's made people question the whole process of immunisations, and do we need as many? And I think so many people, sadly, who are questioning that actually had their immunisations when they were kids, and they just take it for granted in the UK. So I think we really need to do a lot of restoring that confidence. And I think the other thing that happened in the UK, and I'm sure here as well, is because the focus was on the COVID vaccination programme, that some of the other programmes didn't have the focus, so the uptake isn't as great. And also specifically for HPV, where we give that in schools through an organisation called the School Age Immunisation Service, then those vaccinators will spend all their time vaccinating against COVID and flu, and sadly the HPV programme got a bit left behind, and children weren't in school all the time. So once again, if the vaccinators were there, the kids may not have been ready to have their vaccine. So we have got a lot of catching up to do, not just from an education point of view, but also from a programme point of view as well.
Is investing in vaccines equally important as preventative treatments?
Well, vaccines are preventive treatment, or not treatment, but they are prevention. And so if you need to prep for HIV, then I think it's far better if we can stop people even becoming at risk from infectious diseases. And I'm sure, that's the goal in the UK, and I'm sure it's the goal here in Kenya. We need to do whatever we can to stop people being at risk in the first place.
Is there money that the government uses in treatment of diseases that would not have been spent if more had been invested into vaccinations and immunisations?
I think we're perhaps in different states in the UK, in that we have got a quite established vaccination programme, which the infant programme is through GPs and the district nurses and the care workers for the mothers see all the time. And then after that it's through the school system, and then once you're into adults, it's usually when you're travelling abroad and you need some extra protection, then we actually pay for that ourselves, because it's our choice to go to another country that has some infectious diseases that we've eliminated in the UK. So I think we've already got programmes in place that are fully funded. Obviously when it came to COVID we had to find the funding from somewhere else, and it was very difficult, and like any country we'll be paying back the cost of COVID over decades, more than a decade, probably over a generation. If you've got a healthy population, you've got a healthy workforce. If you've got a healthy workforce, then you've got a productive workforce. And that's the same whether it's Kenya, whether it's the UK, that if people can work, they can earn a living, they can look after themselves, and they can then spend in the economy as well, so it keeps everything going round. And it gives them great self-esteem as well. So nobody wants to be dependent on the state, but if you've got poor health, then sadly you have to be. So I think the more you can invest in health, the more you're actually investing in the economy of your country.
The UK has been able to establish a universal healthcare system. How has the UK been able to do that, and what can other countries, like Kenya for example, learn from that?
Well, we've had our universal healthcare system for 75 years, so it's so well established we wouldn't know what it's like without it. But we do pay for it through our taxes, but majority of people in the UK do pay some form of tax. So I think that's quite different in Kenya. And once it comes back to, if you've got a healthy population, you've got a population who work, and a population who actually pay taxes, which then funds the healthcare system. So it is that those different, you need to invest in health first to get people so they can earn, so they can pay taxes, then invest it back into a universal healthcare system. I mean, we're going back to the 1940s when the National Health Service was set up. I don't know how that transition was made, but our system being so well established that I'm sure there's ways that other countries can look at it and adapt what we do in what's right for that particular country. We've got the government and the Department for Health, which actually works very closely with NHS England, and then the health is devolved to the other nations, to Scotland, Northern Ireland and Wales. But the government allocates an awful lot of money, billions, hundreds of billions of pounds, to NHS England, and only a small fraction is used to run the Department for Health, and then NHS England implement the policies that are established by government. I mean, they don't change very often. It's probably minor changes, and sometimes it's we needed to pass legislation, for example, for COVID, but obviously work very closely with the NHS to make sure that we're implementing it, making that the policy match what was able to be delivered. I think the media play an important part, not particularly in the UK for TB, but for other diseases. It plays a huge part in COVID, and also they play a part when there's perhaps some new technology. Recently there was some media coverage about a new way to test for prostate cancer, which is going to be more effective than the existing PSA test. But of course, new tests often cost a lot more money. So quite often if the media and the lobby groups work together, then they can put pressure on the government to provide that extra funding to get a better test to detect cancers, for example, or heart disease early. So the charities in the UK play an important part as well as the media.